5th meeting. Before I get to the agenda, just wanted to acknowledge that today is a very important day, November 5th, where our nation decides to elect officials to lead our country. So I just want to acknowledge that the angst that could be, the anxiousness, the anxiety that could be impacting our communities and where we live. And just want to offer some grace that it is a very trying time, depending on where you live and across the nation. So I just want to acknowledge that before we get our meeting started. And thank you everyone for being here. I'm Annette Magicotomy, co-chair of the System of Care Advisory Council, representing family and juvenile justice voice. Thank you. Thank you. All right, so let's go ahead and get started. Okay. Here's our agenda for today. We'll have an update from Selby Stebbins, Local System of Care Spotlight. We're going to discuss the Youth Adult Partnership, training, and vote. We're going to hear updates of the System of Care Advisory Council work groups and subcommittees and discuss council member work outside the SOCAC that relates to our shared work. We're going to also hear about the Medicaid Operations Coordination Steering Committee and discuss opportunities for the SOCAC alignment. And then we'll also hear public comment. I'll go ahead and Adam will call our roll.
Yeah. All right, let's dive into it. We'll start with Allison Stark and Sonia Little Deer Evans.
Here. Allison starts here.
This is Sonia, I'm here.
Welcome, Jackie Serrano and Sandra Santos.
Jackie here.
Okay. Robin Henderson and Anderson Dubois.
Here.
Here.
Kyle Johnson and Adam Peterson.
Yeah,
Adam
Kyle
Peterson.
Johnson, I'm here.
Adam Peterson here.
Judge Marisa Gates and Jesus Nunez Pineda. Not seeing either.
Jesus is unavailable today and texted me in advance.
Okay, thanks. Grace Bullock and Emily Cooper.
Grace Bullock here.
Don't see Emily. Dan Toma and Cindy Cecil.
Hi, this is Dan. I'm here.
Ebony Clark and Carissa Cousins.
Chris, I'm here.
Jill Archer and April Flint Gerner.
This is Jill, present.
Annette already introduced herself. We've got Dana Hiddle and Andrew Grover.
Dana Hiddle, present.
Andrew's here.
And Alicia Overstreet.
Hi, I'm here. Sorry I'm late.
No, you're all good. And I am Adam Rodakowski. Let's just review our shared agreements. Just a reminder, family and youth are welcome to participate in the meeting at any time. Folks who are members of the public who aren't youth or family can speak during public comment period and freely contribute in the chat. You can also send a private chat to Joylene Carter, Alicia Overstreet, or Annette Magicotomy if you have a comment you want someone to say for you that you don't necessarily feel comfortable saying to the group yourself. So for us, remember that we agree to be present and participate, be respectful, try and avoid interrupting and use names and pronouns people introduce themselves with. Avoid acronyms at all cost, but it's going to happen, folks. So use the chat to write definitions or ask for clarification when those do happen. Again, we come from a diverse group of perspectives and experiences, so we welcome those varied and opposing ideas, but we want to challenge the ideas, not the individual that's presenting them. Please honor those with quieter voices, lean in or lean back. We're not going to problem solve for individual situations, but we will always try and help connect you with folks offline who can support you. Our focus is improving the system of care for Oregon for children, youth, and families. We also hold positions of power in this room, and so just be mindful of those power dynamics and what privilege and power you hold. And always propose solutions, right? Like, we know that we've got a lot of room for improvement, but we absolutely want to be moving towards solutions. Just a reminder, we use the GARE tool to ensure that we're considering racial disproportionality in our decisions. It's the Government Accountability and Racial Equity tool. Thanks. We've got to ask the following questions when we make decisions on policy, program, or budget. And it is in our consensus slide in our discussions as well, but we want to know, what are the racial equity impacts of this decision? Who's going to benefit from or be burdened by this decision? Are there strategies that we need to examine to mitigate unintended consequences? And do we need to complete the full racial equity worksheet before we move forward? So just a reminder that that's how we're centering race in our decision-making process.
Well, I'd like to introduce Selby Stebbins. She's our System of Care Specialist with Health Share of Oregon. She's going to let us know what is the system of care to her. Go ahead, Shelby.
Hi, welcome. And then I have not welcome. Thank you for having me. And then, okay, I was going to say, I just sent some slides to Anna if you want to run those through for me. Thank you. So once again, my name is Selby Stebbins. I'm your System of Care Specialist for Tri-County System of Care, which is hosted by both Health Share of Oregon and Trillium Community Health Plans. And I'm excited today to tell you about some of the work actually that our local system has been doing, and to let you know about some outcomes from our Agile funding effort. So when you think about Tri-County System of Care, I want to say we are more than just Portland. I know it's very easy to focus in on Portland as our population center, but actually our Tri-County region covers a large geographic area. In particular, you can see that Clackamas County is quite large. And in fact, 50% of the zip codes in Clackamas County are classified as rural zip codes, as well as 30% of zip codes in Washington County. And so we actually do have some large spread out rural areas alongside of our dense urban area. And our rural areas experience a lot of the same challenges to service access and delivery that you see in other rural areas of the state. So it's definitely not all about Multnomah County, and certainly not all about Portland. If we take a look at our state system of care data dashboard for the last 2 years, we can see that there were 312 youth in the Tri-County area who were served by 3 or more agencies. And that is actually 35% of the state total of youth served by 3 or more agencies during that same time period. And so I do feel that our local system of care has a particular obligation and a particular role to play in assuring successful implementation of our system of care framework. All right, so next slide, please. So, and it's got some animation on here, so I'll just move through some points. You can click, don't click on it yet, please. So we have 2 primary buckets of work that we do in our Tri-County area. The first is what we call our common agenda. That's the collective impact term we use to refer to our strategic goal or our strategic plan. This was a strategic goal that we identified last year, and we were really excited about it because it was something that all of our partners across all our different systems could agree on. Please hit the down arrow. So our common agenda goal is that by 2027, We want to reduce the number of children and youth ages 0 to 21 who are placed out of their homes by 25%, paying particular attention to the known disparities for out-of-home placements for Black, Brown, and Indigenous youth. We know that we may not reach this goal of 25% by 2027, but part of collective impact work is that you set a bold and audacious goal for yourself. And this is the one that we identified for our local area. I also want to say real clearly that our goal is to reduce the number of out-of-home placements, not eliminate them. We certainly recognize there are times when it is appropriate for children to be placed out of their homes. We want children to be safe. We want them to be getting the structured behavioral health and developmental disability supports that they need, and that sometimes out-of-home placement may be in fact what's best. However, we do feel that we could reduce the overall number of those out-of-home placements if we were successfully implementing the robust array of aligned services we want at the community level. Please, the next down arrow. And just this year, in fact, we just confirmed them last month, we have identified two priority interventions we want to pursue in pursuit of that goal. The first is we want to have implementation of more robust transitional support, sometimes called step-down services, from highly structured environments or formal services to back at home and back at school placements. And we also want to focus on increasing culturally appropriate in-home supports available to families during the assessment phase of their child welfare engagement. Down arrow one more time, please. And as we pursue those two priority interventions, we will be making sure to focus on our system of care value, that services are culturally responsive, as well as maintaining focus on our children with developmental disabilities. All right, next slide. So the second bucket of work that we hold is kind of the historic work of the structure, and similar to all other local systems of care in Oregon, we have a barrier resolution process. We renamed that for ourselves. We're calling it Access and Quality Improvement, or AQI. That was our new action-oriented name that we wanted to apply to our processes. So the first down arrow, please. The first part of our new AQI processes is that we are taking a look at the overall selection of barriers we hear about from the community, and we are triaging those for action. We are triaging those in relation to our common agenda goal of reducing out-of-home placements. We want to make sure that since we can't work on all of the barriers, we want to select some that we feel like will help us to move work forward on our common agenda goal. After those barriers are triaged, next down arrow, please. After we triage those barriers, we are assigning them to one of 4 barrier resolution pathway. So I know that's a little bit of jargon, but again, that was a term we chose for ourselves to give us new ways to think about our barrier resolution processes. We have 4 barrier resolution pathways that you can see there on the slide. We send them to our own structure, meaning our Executive Council and Advisory Committee. Practice level work group can also assign barriers to themselves. We have barriers that we want to check in with our community partners about, and then also we have barriers that we may wish to send to the State Council. We have specific criteria that we look at in order to determine which barrier resolution pathway to assign a barrier to. And the end result of these new processes for us is we feel like we're sending our barriers out in a more simultaneous manner, kind of on a horizontal playing field, versus our historical structure called for us really to work through a hierarchical and much more extended process of moving things up, so to speak, up the hierarchy through the different committees from practice level work group to executive council. So we have had great results this year, and I think are getting more action with kind of this horizontal approach to sending out barriers to be worked on simultaneously within our different resolution pathways. All right, next slide. Finally, I have some exciting outcomes to share about our Agile funding program. So in Washington County, our child welfare partners have set up a metric to help us track the outcomes of our Agile Funding Initiative. So this metric covers a 2-year time frame, and it takes a look at the number of child welfare assessments or formal engagement with child welfare that different families are having. And so these are very specific families that are being presented at the Washington County Child Welfare Preventative Staffing Committee. That is a committee of cross-sector partners who come together specifically to try and help families avoid having to open a formal assessment with child welfare. And that is also the committee through which we are running our Agile Funding Initiative. So basically, what they were able to look at was that in 2023, 18 families met this metric of being able to track them across a 2-year time period of 1 year prior to receiving Agile funding and 1 year after receiving Agile funding. And what they found was that prior to receiving Agile funding, about 60% of those families had not needed to open a formal assessment with child welfare. And that after Agile funding, that percentage had risen up to 83%. So 83% of the families did not have to open a formal assessment case with child welfare. So next down arrow, please. So what we're finding out is that Agile funding is producing some good results and helping to show a decrease in child welfare assessments. And while we can't say that Agile funding is the only reason for the decreased assessments, we can say that families who benefited from Agile funding had fewer assessments. And one more down arrow. Thank you. So based on these positive results of being able to start documenting, again, we're in the initial stage of documenting, and I'll admit we have a small sample size of just 18 families. We should have more families who meet the metric at the conclusion of 2024. But based on these positive results of showing a decrease in child welfare assessments, both Washington and Multnomah County will be using family preservation funding to further expand their Agile funding in their counties to the tune of several $100,000 in each county. The increased funding will be used not only to keep paying for family identified needs, but also to actually hire staff to help run the initiative, because Agile funding is actually quite an intensive initiative in terms of the staff time that's required to receive and process the request and then fulfill the request. So we're really excited about the expansion of the Agile funding in both of those counties, and that our child welfare partners, again, are matching that goal of braided and blended funding and bringing in some of the family preservation funding. And that is what I have for you today. So anyway, appreciated the chance to share some of that work that we're doing in Tri-County area.
Thank you, Selby. Appreciate that report. Agile funding works. Appreciate that. I will go ahead and turn everything over to Adam now.
Yeah, we'll just echo that. Thank you, Sylvia. Appreciate that. Next up, we've got about 25 minutes, give or take, to talk about the youth adult partnership discussion. We touched on this last month, and we have Cameron and Zephyr who discussed this and showed us the link to that youth adult partnership. So I'm gonna, before I go too far, I'm just gonna turn it over to, I think, Christy and Joylene, or is it just Joylene on this one? Just Joylene. So I'm gonna turn it over to Joylene.
Thank you, Adam. Hi, everybody. Yes, echoing exactly what Adam just said. This is a conversation we have been preparing you all for since our last meeting, to talk about a new training that our youth put together called Youth Adult Partnership Training. If you haven't seen it yet, I heavily recommend you do, and I am putting a link to it in the chat right now. Before we begin this discussion, I really want to give space for Cameron and Zafir to unmute and introduce themselves to you all.
Hi there, y'all. I apologize if it's loud. I am at my favorite cafe doing crochet prep for the busy holiday season. I am Zafir Michael Berry. I use he, they pronouns. And I will toss it over to Cameron to introduce himself.
Excuse me. Hi, I'm Cameron. I use she, her pronouns, and I'm part of the youth council. And yeah.
All right. Sorry, Zafir, did you have something else you wanted to say?
No, it's okay. I forgot mid-thought, and then I was like, oh no, they're gonna hear cafe sounds.
No worries. I do also want to acknowledge a special guest in the room. We invited Liz Thorne here. For those of you who did watch that training, you'll notice it was facilitated by Cameron, Zafir, and Liz. So Liz, I also want to make space for you to introduce yourself if I'm not calling you out.
Oh, thank you, Joylene. I appreciate that call out. Hi, everybody. My name is Liz. I use she, her pronouns, and I'm the director at Matchstick Consulting and had the absolute honor of getting to work alongside Zafir and Cameron and other members of the Youth Council to co-create this training. So thanks for everybody who watched it. And thank you, Joylene, for letting me know that this discussion and vote was up for today. I'm excited to watch it.
So I'm also going to pass it back to Cameron and Zafir, however you want to do this. We kept those same presentation slides up if you want to give a very brief rundown of what we're all here talking about today. What is Hart's Ladder? What's the flower model? Super quick, and then we'll dive right into questions.
Heck yeah. Cameron, do you want me to just dive into it, or would you like to start with one or the other?
You can start.
I can start? Okay, cool. Hi y'all. Today, we're hoping to get your guys' vote to make it, I believe it's to make it mandatory to change the Hearts Ladder to the flower model. Because I think right now the model that's being used is the Hearts Ladder model, which is the one that's on screen right now. Looking at it from a youth lens, it's a lot more rigid in its description. It also, the way that it's a ladder, right? You have to start from the bottom rung to get to the top. It also shows that manipulation, decoration, and tokenism are required in order to get to the top of that ladder, which is why we wanted to switch over to the flower model. If you want to, I don't know who has there we go, which as you can see is a lot more intricate with a lot more moving parts. It's a lot less rigid and allows for growth. It's a flower, you know? All those negative things are seen as bugs or as pests, as versus seen as rungs on the ladder to get to the top. Cameron, is there anything you'd like to add?
Not really. I think you did a great job, and hopefully most people actually watched the training. So this is just a refresher for them, but yeah, we wanted to open the floor for questions that people might have had about it, or just like more discussion about what they liked or didn't like about this.
Yeah, so let's do that. Opening this conversation up to all SOCAT Council members, and of course, folks with lived experience in the room. Do you have any questions, concerns, feedback you want to share with these incredible young leaders? Go ahead, Emily.
So I think this is wonderful. I, not to show my hand, but I think moving to the flower model makes a lot of sense. I think between the last SOCAC and this one, coupled with watching the training and seeing how you thoughtfully went through each of these, it makes sense to me. I think the questions I have is even, when you look at this at the very top of the screen, it talks about inclusivity and intersectionality. And I know here we're talking a lot about youth versus adult because we're a system of care advisory council that's supposed to be looking at youth serving systems, and there are a lot of adults here. And so I think I think it makes sense that we're starting here. But the question I have is like around the intersectionality, like how would you see this flower model when we're also talking about race, gender identity, disability, other, intersections of identity? That's kind of my main question, because I want to make sure we're doing this right.
Yeah, Cameron, do you want to start? Or do you want me to start?
I'll let you take this one again.
Okay, got it. So I want to make sure that I have the question right. You want to just kind of like, from our view, see how we would, where we would put those specific other parts of this, those other things that are part of intersectionality, such as race, gender, orientation, disability, and how that would be personified in the model. Am I right?
Right. And I mean, and it could be when we talk about youth adult partnerships, it's the pink flower. And maybe when we talk about gender identity, it's purple. Like, is it just a garden that we look at, or do we need to look at, and I say this because I think as someone with multiple identities myself, is it more that it's within the same flower? Maybe I'm trying to figure out how to bring that, if y'all thought about that, and then how to bring that in.
Emily, are you kind of thinking like that if we're using the flower model and it's not just a youth and adult partnership, but it may be a person with disabilities and a person who has not yet been diagnosed with disabilities, like what does that DD, non-DD partnership model look like? Is it the same structure, but we just sort of sub out the word youth for the word person with IDD diagnosis, or?
Exactly.
Okay. I don't know, Zafir and Cameron, if you have a response to that, but say what comes into your minds.
I think I do. I think I have something. I really do like the idea of it being a garden, because one flower is pretty, but a bouquet is magnificent. So if you have, for example, this is intersectionality for youth and adult partnerships. There can be another flower that's specifically how do you integrate people of color into your workforce? How do you integrate people of different gender identities? How can you integrate people with different levels or identities of disability? I think that makes a lot of sense. I think each different part could have a different flower versus trying to make it all one thing, because it's all very different. You know what I mean? You wouldn't reach out to this person the same way you would reach out to that person. You know what I mean? Especially when it's a completely different, like there's intersectionalities between, like someone can be a person of color and also be, gay or trans or something like there's already intersectionalities under that umbrella. So I think having them all be a part of a garden makes more sense than funneling them all into one flower.
Thanks. That makes a lot of sense, and it's beautiful.
Thank you.
I will share that this flower model specifically around youth adult partnership really gets to that the sneaky way that ageism can sometimes like inhibit the progress in our work, and we might not see it. And so this is really getting to like how adults, regardless of their intersectionalities, can work well with youth, regardless of their intersectionalities. And so I do think that I am loving the garden idea that we are all talking about. And we're looking at capacity strengthening, like the water coming down, the enabling environment we want to build together. All of these things, I think that when we get to specific communities, the difference is in the specific strategies that we use to tend our garden might look a little different depending on which community and who needs that. But together as a council, if we all understand that this is the first step to us collectively tending our garden, and that being our community, the people that are in this space together, and how we treat each other, and the kind of power that we give each other when we're in the room together. Anyone else? Other questions, comments, feedback?
I love questions if anyone has them. it gets my brain firing at full cylinders.
I'm seeing so much richness in the chat that I'm going to read some of this out loud in case folks aren't able to see the chat right now. From Caleb, another one of the Youth and Youth Council, says, I think the intersectionality to me is a step in equity and a window to diversity in approach. More or less a state lens and more human-centric lens, if that makes sense. Hearing love for the bouquet idea, Alicia shared a quote, one flower is pretty, but a bouquet is magnificent. I love it. I'm also seeing SOCAC staff, I believe that's Anna, say, and different types of flowers require slightly different care. So each partnership model could be different as appropriate, but still growing in a base of freedom of choice, information, shared power. Absolutely. So there's lots and lots of love for this garden framework. Zafir says, I would love to conceptualize more flowers as well. Love, love, love that. And Cameron says, people of different identities can be the pollinators. Absolutely. There's so many directions we can take this framework. All right. Any other questions? Again, we are about to take a vote, so speak now if you have questions, concerns, comments. We did receive a couple more questions through email, and I believe they came from Emily, so I'm gonna glance at these and make sure that we address all of them. The first question is, does the heart ladder model require that you go through all steps or simply stop onto the rung where the agency or group is located? In full transparency, I think we're likely somewhere between 3, tokenism, and rung 4, assigned but informed. Whoever is managing slides, would you mind going to that hearts ladder slide so folks can see for reference? So this question can be for Cameron, Zafir, any other youth or adult in this space who has used the hearts ladder. Does it require that you go through all steps?
I mean,
Sorry.
I was just gonna say, like, ideally no, but I think that's like the implication of it being a ladder. Is that like you go, I don't know how, I haven't climbed a ladder in a while, but I'm pretty sure that's how it works. So.
I was gonna say that, just like Cameron said, ideally no, you shouldn't have, it shouldn't be that you have to do the bottom 3 rungs to get to the top 5. But at the same time, it's pretty hard to get to the 5th rung of a ladder without climbing the rungs that came before it. So it is implicating that that's what you have to do to get there. And this is coming from someone who, when we conceptualized and were planning out the flower model, I was like, what do you mean? The ladder's fine. I mean, it's very obvious, very noticeable. Yeah, what's wrong with it? And then I really, and as someone who is autistic and needs it bluntly, I was like, yeah. But when I saw the flower model, and I was like, oh, this is really complicated. There's so much more that goes into getting past these rungs and eliminating them completely. Because my personal opinion, I think that young people and families or consultant informed should be the bare minimum. And with this ladder model, it says that you have to do all of these before you can even hit the bare minimum.
Thank you both. One more multi-part question. What would you like? what would youth like to see in order to have authentic participatory leadership on the council? Cameron mentioned 4 youth being on SOCAC. How can we support that? And are there other asks?
Cameron, I'm gonna leave this one up to you. I know that you have a good idea of what you think is a good idea.
Yeah, I think that's going to be in the proposal for this upcoming legislative session to add 2 more seats. It's like not as easy as we want it to be, just saying like, oh yeah, for sure. But I don't know, it's cool to see so many youth here at the full council meeting today. It's not just Saphir and I. You're gonna get sick of me. I'm gonna talk after this too. So yeah, just like inviting us to be able to tell you what we're doing ourselves, especially when the stated goal of the council is to help these systems that are affecting youth and families. I think who better to hear it from than those people themselves. So even if it can't be an additional 2 voting members yet, we're working towards that. And in the meantime, just inviting us to sit at the table and use our voices as representatives at least is, I think, a really good step. So yeah, thanks for having us here today.
That's great. All right. Final ask for other questions before we hold this vote. And also, Cameron, we love hearing your voice. We're not going to get sick of you. Okay, in that case, I just want to thank you all so much for engaging with this training, and I'm seeing a lot of people sharing it with their staff and coworkers, colleagues in the chat, so please keep it spreading. We hope that the changes we make internally can be infectious and your system can also benefit from the work these folks are doing. I'm going to hand it off to Anna to hold this vote. Thanks.
Thanks, Joylene. First, as prompted by our consensus process slide, are there any racial impacts of replacing the ladder model with the flower model that we want to name or articulate and then address? Saw a couple of no nods, but I want to make sure we leave some space for anyone who might have a yes.
I don't think there's anything negative that I'm seeing, at least.
If you do have a concern and you don't want to say it out loud, you can message it to Joylene, Alicia, or Annette, and they can speak it out. In the meantime, I don't see any, but that doesn't mean, oh, and Emily's pointing out, given the garden approach, we have at least discussed sort of a racial impact in some ways to be explicit in responding to that. Good point, Emily. So in our consensus process, the first question is there any voting members? That would mean you're either appointed by the Chief Justice of the Oregon Supreme Court or the governor's office directly. Any voting member of the council who wants to block this decision and say, no way, I love the Hearts Ladder. I refuse to let us move forward with the decision to replace it with the flower model. Raise your little Zoom hand or unmute and say your truth out loud if that's the case for you. Okay. Is there anyone who has concerns that they'd like to discuss or highlight for the group before we move into a stand aside or agree opportunity? Any lingering? I'm not quite comfortable. Sandra Santos.
I think the only concern that I have is the potential harm that could be done. I think our intent and our desire to embody a model like this and to include the voice is there, and I believe the commitment of this group, and I feel like there are times that we might get ahead of ourselves or fall short on it, and I just, that makes me nervous about the potential harm that could occur.
The harm of like unmet expectations, maybe?
Yeah, that's what I mean. That's what I mean, that we fall short and that that get frustrating or disappointing to the youth on this, in this group and others. So, and I think we have to try. So I'm not, I would definitely would not block, but it just, I'm thoughtful about it.
Thanks for sharing that. I think that's important. Anderson?
This isn't necessary a concern at all. I think just a point of discussion afterwards, should this move forward. To that concern that was brought up, I think it would be good to at some point have an intentional conversation about what does it look like to replace the model practically, like how can we embody this so that there aren't those that harm that decreases the chance of there being harm done, very much in the same way we have this model where we practically use it and understand it for voting. Like, what does it look like to include that model in our decision making, in our relationships with the roles that youth occupy, and how we can empower them on this council. I think that is important. I don't think, at least for me, it doesn't change my vote, but I think it should be a part of the next implementation piece should this move forward.
Awesome. Emily Cooper?
Yeah, I agree with both Anderson and Sandra. And I think for me, one of the key takeaways that I heard from Cameron is maybe one practical measure of if the flower model is truly being adopted by this council is how many youth we have as voting members. This is just an example, and how many youth we have in leadership positions by really doing this. And I think Sandra's right, like, we may not be able to do this, right? And for me, I completely agree. It doesn't mean we shouldn't do it. But if anything, it's like, we need to be prepared that if we don't succeed in it, that maybe there's something wrong with our engagement, or there's a way we need to be thinking about this council differently so that we can be more youth-led. But I think at the work, we didn't get here because we didn't try. I think it's going to be not maybe as straightforward as we want, but I think it's worth trying. But for me, Anderson, to your point, I think practically speaking, that's one thing that if we're really going to adopt this model and be authentic, that's how our council will probably end up looking, but it may take us a while to get there.
And I see your hand up, Zafir, and I'm going to call on you next. But I think one of those next step implementation conversations that Anderson just suggested we have, I think the council too needs to come to a clear determination of, are we youth led, or are we doing youth adult partnership? Because those are two different things. And I think when we speak about unmet expectations, if some of us are expecting that we're a youth-led council and some of us are expecting that we're operating in a youth adult partnership model, then we're definitely going to have unmet expectations if we're doing the other thing than what you're expecting us to be doing. Zafir.
Yeah, I just had a couple things I wanted to say after listening to everybody. I completely understand, especially from like a council perspective, trying something new and being worried that people will fall through the cracks, that maybe it's not rigid enough to stay afloat. But my 2 cents, as you know, one of the youth that worked on it, and a youth who's been involved with many different types of systems throughout my short 20 years, I feel like it encapsulates more people than the other model, than the latter. I think it allows for a little less rigidity. It allows for more mistakes, and it allows for a youth partnership to flourish versus being just ticking a box. This is good, this is good, this is good. It allows for people to grow and to learn and to experience things versus just what it may look like on paper. It allows for more fluidity and more, not chance, and allows for more ways. I feel like it allows for more ways for people to be reached out to and to be brought in and to be understood versus stepping up rungs on a ladder once you feel like this has been ticked off a sheet. But yeah, I don't know if that quelled anything for anyone, but I felt the need to say that.
Did anyone want to respond to Zafir's thoughts or comments? Abigail in the chat mentions, I've helped work on this model with other youth, and I haven't come across any youth so far that didn't like or understand this model. So it is complex, but I think what Abigail's saying is it does make sense to to youth with whom she's discussed it. Any further discussion on this topic? So this is the agree with reservations or just naming our reservations. Now we're moving into the are you ready to consent, voting members, to replacing the ladder with the flower. If you are a voting member and you consent to this, go ahead and raise your Zoom hand. You can go to reactions down at the bottom or just react. It has a little heart and then push raise hand. Just leave it up for a sec so that we can count.
And Anna, could you put the flower back on the screen?
I sure can. There you go. Dana Hiddle. I don't know if Dana was able to watch it, but I don't know if you want to vote, Miss Dana, but we're inviting you in.
I am so sorry I had to step away. I'm all for it.
Okay. Dana, say yes. Thank you.
That is a yes. Yes.
And I'm looking across our other folks to see if we have other members that are not. Let's see. I don't see anyone else. So all voting members who are present currently are consenting to the change. If you have concerns, this is your last chance to say them out loud. So go ahead and take your hands down. You are all so obedient. I love that we finally got this consent process down. Okay, Annette, are you speaking to a concern or you just have a lingering hand? Sandra, concern or linger? Okay, then we have decided. Thank you, Zafir, thank you, Cameron, and thank you, Liz. We have decided to replace the Hearts Ladder model for youth engagement with the Flower model for youth adult partnership. We will be updating some documents, we'll be updating our member handbook, and we will get links out to you all with those updated materials, probably in our weekly digest, as soon as we can do all of that fun editing work. Joylene, is there anything else on this agenda topic that you want to make sure we get named before we move on? Okay.
Wait, sorry, 1 second. Sophia, Cameron, do you have any final thoughts you want to say?
Cameron, do you have anything? Because I just have like final words.
Excuse me. Thank you everyone for, yeah, I don't know. I didn't want to like bias the decision too much, but also I think even just like listening to us and inviting us here to talk about this and moving forward with this model is like a good way to exemplify youth adult partnership and like working together to make these decisions. So thanks for having us to talk about this, and thanks for asking questions and engaging with this work we did.
Yeah, I want to bounce right off of Cameron. yeah, you know, having something made by youth as a part of the youth adult partnership makes it exactly that, youth adult partnership. And it also engages youth, such like us. Though I have to leave right after this, I just want to say thank you guys for letting me be here. Really appreciate it. And this is probably not the last you will see of good old Zafir. So yeah, I hope everyone has a great day.
All right, thank you, Cameron and Zafir, for that presentation. I'm just amazed at the work that you all do. So thank you so much. Appreciate it. Now we're going to get into our System of Care Advisory Council Subcommittee updates. We're going to hear from the Oregon Youth Addiction Alliance from Cameron Burke and Caleb Gamby. And then we have a bylaws work group that is needed. So we'll get into that as well. So go ahead, Cameron and Caleb.
I'm back. Still me, Cameron, still use she, her pronouns, and I'll pass it over to Caleb to introduce himself really quick.
Hi everyone, it's Caleb with the K. He, him, for those who haven't had a chance to make the introduction. And thank you for that, Annette. And again, having us here, really excited to share some updates and exciting information about 6 new youth to the system that we are very excited to orientate and support through this this I want to say the end of the beginning process, you know.
Okay, back to me, I guess. So, what is the Oregon Youth Addiction Alliance, you may ask? Basically, it's a partnership between SOCAC, specifically Youth Council, and ADPC, which is the Alcohol Drug Policy Commission. And this was put, basically, our goal is to create a strategic plan for Oregon moving forward in how they address youth addiction treatment and oh wow, hey, how they address youth treatment and or sorry, I got very distracted by that for a second. And yeah, so we just recruited our youth members because of how the statute works. Basically, we could only have 15 total and total members, and that includes ADPC commissioners. So we were able to welcome up to 7 youth, and we selected 6 youth out of 16 applications. So we got an incredible turnout. So thank you to everyone who sent out our application. We're really excited about those youth we recruited. We have a pretty good spread of people. And yeah, I just want to hand it over to Caleb. He's been working on it since the inception. So I know it's been really rewarding for him to see this all come together. So I'll pass it over.
Yeah, no, that was great, Cameron. And yeah, as far as the youth council goes, well, I just want to give a shout out to Joylene and Wes too for being awesome, and not just awesome in that sense of like their jobs and roles, but also being the facilitators and doing the support work and making the time and capacity to ensure the youth are up to date and doing the orientating like on their own time per se, outside of their structured work schedules. So just want to like really acknowledge that and say that's been a huge like benefit and like reason that we've been successful. Someone said to me recently, the first one through the wall always gets hurt. And so that being said, I think this is one of the most exciting experiences I've had the opportunity to be a part of, and it's really an honor to work with everyone in the space. Darlene, Wes, Rivers, and Cameron really have made this like a space that's like the work can be sustainable. It's really not always a feel good work. Addiction is really a mean thing. And that being said, having a community to uplift you when you are and having the opportunity to use that to support and really empower others and their struggle is a huge blessing. And to have that space and be able to connect with other youth in the debrief space and acknowledge these concerns and address them and how we can support and uplift each other outside of just the opportunity in these council spaces. So I think there's a lot of I want to say there's as an artist you like to be undefined by definition but infinite in potential, but I really do think this council has the opportunity to do that, not just per se there's a very defined scope and definition, and we are very determined to accomplish that and go above and beyond, and perhaps even consider like what else we can accomplish in this time frame that we're given. But yeah, it's very exciting to now have 6 other youth. For a while it was just me and Cameron having to make decisions on how we can best accommodate and really make this sustainable work for youth, and not that is, but it is a pressure and something if you've had like a rocky start in the system that you do take personally and want to like put pride in knowing that these experiences are going to be really impactful and meaningful to these youth. So that is oh yeah, in a nutshell.
Yeah, so thanks for having us. Just to finish up, I guess, some more updates from us this time. Hopefully, we'll be back next month with more updates, but we built a charter, which is exciting. SoCAC Youth Council hasn't done that, so we're kind of working together at the same time on that. So it's just exciting to see how fast Oh Yeah is moving, and yeah, that's been pretty cool. And then we brought on a new contractor to help facilitate our group, and that is Common Thread. I think they're working with some other areas of SoCAC. So we're excited to get to know them and introduce them to our youth in our committee at our first public meeting, which is in a few weeks, and it's live. So if anyone wants to attend that, you're more than welcome. And we would love to see some familiar faces there and get your guys's feedback on what we're doing. And if anyone just like wants a better idea of what we're all about, hopefully, I don't have the information off the top of my head. I think it's at the end of November. So yeah, just maybe Joylene can get that in the meeting summary, the information for that meeting. So thanks for having us here today. And that's all from me.
Yeah,
Just
the
have to
official
say,
meeting is the 22nd. And we're excited that this week we get to introduce our youth to the 80 PC side of our commissioners. And we're happy to. Thanks for putting in the chat, Jolene. Any other information or just like ways that we can engage and interact with our other departments and systems within this council, we really want to extend an invitation of support and encouragement. This is something I think kind of involves all sorts of different areas overlapping, and I just don't want to categorize one thing into like how can we all like utilize the garden because we're all growing in this garden. I think that was a great tool or visualizer way to look at it. But that's all we have, and we just want to say we're very grateful for this time and in y'all's capacity to make space for us.
thank you so much, Caleb and Cameron. I'm so I think it's just great to have you two in this space. You've been working really hard over the last year, and I really appreciate the work that you're doing. So A lot of times youth, they're left out of the recovery, substance use occasion, conversation, but I'm so glad that we have you two there representing youth voice and really getting involved. So it's definitely appreciated. Thank you so much. And now we're going to have a conversation about the bylaws work group that's needed, recording subcommittee and work group meetings, defining official business, and the idea of automatically allowing youth council members to vote on other SOCAC subcommittees. Anna?
So if you want to be a part of this year's, the 2025 bylaws work group, it's a lot of fun. You get to work together on a Google Doc. You get to make decisions that affect everyone on the council and the subcommittees, and weigh some priorities that'll just have to be talked through as we go about that bylaws updates. So if meetings and decision making is something you like to do, and I know it is because you're here, go ahead and raise your hand. Ideally, we'd have 5 people or more if folks really want to get involved. I love to have people with lived experience represented, especially as we are looking for how to set fair guidelines around what does official business mean in our context, and that would indicate who's eligible for stipends or what kind of work is eligible for stipends, not who. That's already defined. So I see Cameron and Caleb. Adam Rodakowski. Anyone else?
Start choosing people.
I would love to. I think it's just going to come down to my availability.
I'm putting you on the list, Anderson.
Yeah, pencil me in. Yep.
Yep. I wrote it with pen. You can't get out of it. Anyone else?
Did I tell some people? I'm going to start with council members who have their cameras off, I think.
Oh, there they go.
I would love to help out, Adam, but it's getting ready to be legislative season, and I think that I'm pretty tapped out with legislative season.
Kidding, of course, but I will probably back channel some of you and see if I can get another person or two to join.
Okay, that'd be great. So right now we have 4. If we can get 1 more, that's ideal. If not, you're all just going to have to live with the decisions that these 4 make. I think that's it for bylaws work group. There we go. I don't know whose presenter's agenda has you. Who's up next?
Back to Annette.
Oh, me. Council member updates. Appointed members of the SOCAC are invited to share what they're working on at their job or other councils or commissions or with their communities that relates to SOCAC work. Goal, honoring the wisdom in the room. We have 30 minutes for updates and discussion. So if you have any updates, just go ahead and raise your hand and we'll call on you to give updates of the work that you're doing.
And I put some examples on the next slide because we do know some of you participate in some of these other spaces. So if you don't have an update and your name's on this list, that's fine. But just wanted to kind of help you all think about like, what are we even talking about here? Robin Henderson.
Well, I would be happy to give 2 quick updates. There are 2 committees that I sit on that intersect with the work that the SOCAC does. One of them is called out in this Ideas for Member Updates, the Behavioral Health Crisis System Advisory Committee, also known as BOOCSAC. We call it BOOCSAC. But while primarily focused on the 988 system and primarily focused on adults at this time, we do periodically talk about the intersection with youth, the lack of consistency, especially in the crisis system. Currently, one of the most, and I'd be interested if people have feedback or thoughts about this, one of the current topics of conversation has been about crisis response in emergency departments. And this is particularly relevant for individuals who are in rural areas outside of the metropolitan area. in most of the metropolitan area hospitals, when somebody presents in a crisis, in a mental health crisis, when a youth and or their family present, there are social workers and other teams on site there in most of the metro area hospitals that deal with that. The farther away you get from the metro area, the less likely the expertise is to be there in the hospital. And some of the counties have there's a disconnect between county response and the hospitals that is being worked out and attempting to be resolved. But it's especially impactful, I think, for the youth system because that system is even less resourced than the adult system. So that's been one of our conversations. And if you have thoughts about how that's working and or not working in your communities, I'd really be interested in that feedback. The second committee that I'm sitting on right now that has impact for this work is the House Bill 4092, which is the Committee for Administrative Simplification. We are at an interesting crossroads in that committee, looking at some significant changes to the roles counties and CCOs will play. Again, anything that touches children, I've asked that that be pulled and paused and given to the SOCAC for conversation. We're not to anything that's really touching children yet. There's been a little bit of chewing around the edges of the abuse reporting and things like that for adults, but not for children yet at this point. So probably less to do in there, but truly, if you have feedback or thoughts around the youth crisis system, that would be super helpful.
Thanks, Robin. Do you want to put your email in the chat so folks can reach you? I mean, if you're on the council, you probably have Robin's email, but Allison, I saw your hand up and then it went down. I don't know if you had anything you wanted to share. Nope. Okay. I don't know who OR0120035 is, but you're up next.
Hey, Anna, it's Ebony. I'm driving and that's my phone. Hello, everyone. So just in terms of ADPC, I think that two kind of relevant, or there's a couple relevant kind of updates where, I think that as we continue to make sure that we're bringing increased parity on the youth side in terms of, the major issues and priorities that we're thinking about to help address the issues and challenges, there's a recognition for conversation around how do we really start to really assess what the true capacity needs are on the SUD side. When we think about, number one, the legalization of marijuana and just kind of how that has started to impact, the level of referrals that we're seeing in terms of young people being referred to treatment. And especially thinking about the residential levels of care, I think that I've heard on different points or different sides where, folks are like, we don't need more capacity because we're not even getting the referrals, in that we have capacity for. And then, there's the opposite. So, I think in talking with Annalise, there's recognition to try to figure out what is the right strategy to assess what the real SUD needs are for youth and young people. So there's that piece that I want to bring forward. And then I know also that as we continue to talk about the workforce crisis and trying to think about how do we bolster and incentivize the workforce, how are we not losing sight of that? And, I know that, there are some through lines and connections between SOCAC and ADPC in terms of exploring workforce needs on the youth side for both mental health and SUD. So those are two things that come to top of mind regarding ADPC. So thank you.
Thanks so much, Ebony. Jill?
Hi, I wanted to just share a couple things. One is we in the metro region partnered with 4D Recovery to open some co-occurring. They just for the first time are becoming a treatment provider versus recovery support, or in addition to, and we'll be opening co-occurring mental health and substance use treatment for youth and young adults. And then next phase, they already have a building, SUD residential for youth and young adults. So we're super excited for that, to expand that capacity. But then I also wanted to just give a shout out in our Columbia Pacific region. We have an annual summit and it's been primarily focused on SUD. It's been called like the SUD Summit. It started as the Opioid Summit, then it was the SUD Summit. Now it's the Community Health Summit. And this year, for the first time, there was a second day that was all focused on the youth system of care. And Columbia Pacific CCO has been partnering with Youth Era to run a youth council, a youth advisory council in Columbia County. And we're actually expanding that to Clatsop. But they were able to help build the content for the day and present. And so that's, I think, going to be something that we'll do annually, which is super exciting. So I invite everyone to come next year. It'll be in October.
Awesome. Thanks, Jill. April Flint-Gerner, I'm calling you out. Do you have any updates on the Juvenile Court Improvement Program Advisory Committee?
I knew you were going to call on me. I thought this was a volunteer. Hi, I'm April Flint-Gerner, she, her pronouns, Child Welfare Director with Oregon Department of Human Services. I did not go to the last big JSIP meeting, so I am hurrying to look at notes. Come back to me. I might have something.
Sure. And even if it's just like, what even is that? I don't think most of us in the room know what you do. So feel free to get something to say, but we'll come back to you.
Yeah. And I think it would be a good agenda item to talk about the whole JSIP project at some point and maybe give a little overview at some point here for this group.
Okay. And I don't know if I should say this out loud, but your phone a friend, Brian Detman, is also in the room if you want to invite him to speak on that topic as well.
Thanks, Brian.
I'm going to look also to Adam Peterson on the Behavioral Health Metrics Committee. Curious about what work is happening in that space.
It is been pretty interesting because it's a lot of new folk in the Behavioral Health Metrics Committee. And so in the couple months that I've been a formal member, it's really been just a kind of a restart of the group, going over what the purpose is, what the goals are, and starting to get closer to actually going over things that are going to be impactful to folks in Oregon. So really it's just been a kind of an initiation or integration period for a lot of new folks joining the committee. So I don't have too much to report yet, but I think soon we will be diving into the real work in the committee.
Gotcha. Thanks, Adam. We look forward to more updates when you get into the real work. And Ebony Clark, your hand is up.
Yeah, and I'll just add to that and happy to, send forward some slides if it's helpful. But in kind of the reestablishment of that metrics committee, there is an understanding around needing to be explicit around having some key deliverables that are feasible and attainable. And as that committee has been reestablished, the focus around some preliminary or initial deliverables over this next year is really leveraging that space and table to help provide recommendation and feedback on the new upcoming county contracts, what we call the County Financial Assistance Agreement, CFAA, leveraging that table also to help provide recommendations around our Measure 110 data strategy specific to outcomes and reporting. And then lastly, making sure that, we're leveraging the table around CCO 3.0 and thinking about outcomes. And so those are kind of the three areas that have been identified for that committee to kind of start to focus and lean into.
Awesome. Thanks, Ebony. And not all of us are paid to follow all of this information on a regular basis. So the Behavioral Health Metrics Committee, correct me if I'm wrong, but that is a committee that is sort of organized by the Oregon Health Authority, and you are all tasked with coming up with sort of success metrics for the CCOs to make sure that we're tracking that they're doing the work the way that the community having the impact that we want them to have on communities that they serve. Is that accurate, Adam or Ebony?
I would say it's broader than just CCO. And I would say that, you know, keyword advise and bring forward recommendations. And it is governed by the Oregon Health Policy Board.
Got you. Okay. So that's what that committee is. And then you also mentioned, Ebony, CCO 3.0. So that is the process that the Oregon Health Authority is using. That's sort of quick terminology to say the next round of contracts for the CCOs that exist in Oregon. And that process is happening sort of now. And those new contracts are hoped to be signed by when?
January 2026, right, Jill? Or am I messing up?
Say the question again.
When are the new CCO contracts? When are we hoping that they're all signed by?
Oh no, not 26. I think
Is it
it's
27?
Yeah.
Okay.
I think the procurement would be early 2026 and then the contract.
Yeah, that's right. Thank you.
And Samantha Shepard in the chat confirms from CCO Oregon. So that big procurement process is where the state comes out and says, we need to contract for coordinated care organizations to be the Medicaid management organizations across the state. Here's what we want from you. And then provide the CCOs or new CCOs will apply and say, this is how we can go about meeting those needs. And then the state will choose who to contract with. So it's this huge process, has a lot of laws and rules involved. And they're taking feedback from us and other folks about what we want to see from the CCOs as they go. And then there was a third, I can't even remember what the other thing was, but yeah, lots of sort of esoteric information that if you aren't paid to do this work, you may not know what we're talking about. And Ebony, did you have more to say? Your hand's still up.
Oh, no, I'm done.
Okay. April.
Just so you all have it, the juvenile court improvement project. Oh, I didn't mean to put all that in there. Oh, here you go. The vision is really around raising the profile and priority of child abuse and neglect cases in Oregon. And in short, the goal is for us, and the mission is to really collaborate on improving the juvenile dependency system and in ways that advance equity, consistency, improve outcomes for system-involved families. The last JSIP meeting that I was not at, but thankfully they're really, really good at sharing all the notes with me. We've been looking at the strategic plan for 2024. And so there are a couple of projects that are a pretty big deal that I'd love to chat about for just a second. So there are folks across the juvenile dependency system that are a part of this work. Partners include child welfare and other citizen review board folks and the Oregon Department of Justice, court-appointed special advocates. So lots of different folks. And the federal government has a technical assistance provider that is called Capacity Building Center for Courts that works with this program as well. And so some of the things that are coming up in this year are around the key quality improvement areas and priorities around timeliness to permanency, quality court hearings, safety, and youth and parent engagement. And so a couple of key projects there are some efforts to get some questions to juvenile court judges to help with safety decision making. And so they really want to get these safety decision making questions to judges to ask at all protective custody and shelter hearings, again, trying to increase the consistency. Also during when we're talking about decisions for sending kiddos home, returning home for reunification. And then there are a couple of projects that are focused on the Indian Child Welfare Act and increasing our state tribal partnerships. And really, again, are we making sure that from a prevention space and from a quality court hearing space, are we trying to make sure that court hearings for children who are members of one of the 9 tribes of Oregon or who are eligible under the Indian Child Welfare Act that we have that level of consistency in the decision making that we know ends up impacting disproportionality. Another project that is working is on the development of actual ICWA, or Indian Child Welfare Act courts. And so there's a goal of expanding what we call ICWA courts. There's a second ICWA court that just started. There's one in Klamath County and another one that just started in Marion County this last month. So that was a really, really big deal. And some of the what drives it, this desire and need to have specific courts to handle ICWA cases is, at the end of the day, ODHS child welfare data shows that American Indian and Alaska Native children are disproportionately overrepresented. And in 2021, although Native American children only accounted for 1.5 of Oregon's child population, they made up 4.7 of the children in foster care. So almost, that's a disproportionality index of over 4. That's an index rate of almost 4. And so really we're talking about how are we leveraging our court partnerships, expanding ICWA courts, partnering with tribes to really figure out if we can't get those numbers moving in the right direction. There's some other work that's going on outside of the Juvenile Court Improvement Project around that as well with the ICWA advisory, but specifically for the Juvenile Court Improvement Project, it is the expansion of the ICWA courts and getting judges trained in the Oregon Indian Child Welfare Act as well, because judges making decisions, if they don't know the information, makes it really hard to make consistent decisions. So JSIP is really trying to help create some on-demand multidisciplinary training on Indian Child Welfare Act and Oregon's Indian Child Welfare Act. And again, that audience is really, anyone who can access the OJD website. But to get that training up for judges, local court staff, Department of Justice, defense attorneys, anybody in Oregon child welfare. And so there's been a partnership across child welfare ODHS on that project. And then there's also some data collection work that's happening around that. We got to make sure that, we are doing what we are statutorily required to do, both by the federal statute and state statute around early identification of Native American children, and making sure that we are collecting that data and that we are that we have quality in our data is going to be important as we really look at what efforts are helping to decrease disproportionality. And then the last one that I'll talk about is expansion of our state and tribal family preservation efforts in Klamath County. Right now, Klamath County is the only place in the state where we see a significant reduction in disproportionality. We've seen a significant reduction in the number of children in foster care that are Native American and that are Klamath tribal members. And I think it is absolutely connected to the strong tribal and state partnerships around early identification of family needs, partnering around our anti-poverty and concrete and economic supports, and identifying those supports that families need to avoid coming into foster care. So that family preservation work is really, it's gaining a lot of national attention because we are seeing disproportionality rates, cut in half, but we also know that it would not be possible without that strong relationship and engagement with the tribe. It is not DHS that's doing it. It is absolutely leaning on the wisdom of family preservation and prevention work that tribes have known and been utilizing with their families for thousands of years. And so I think it's just it's just a symbol that we're doing a little bit better in terms of listening and partnering with communities to serve their families. So JSIP has got quite a robust list of things that they're working on this year, and I think it would be really cool to see where there's some intersections and opportunities around how improving, again, consistency and education and opportunities for juvenile courts and court partners, as well as opportunities with the Children's System of Care Advisory if there are learnings, lessons, progress that has been made through the Juvenile Court Improvement Project work to bring to System of Care. So that's the best I can do with having not actually been at the meeting.
A very thorough update for having not actually been at the meeting. Next person I'm going to call out, Sonia Little Deer Evans. We have the Juvenile Department Directors Association, but then you mentioned in the chat there's also another, what did you say? I'm sorry, quality. Where are you? You can just say it. You can say it.
Yeah, it's the Juvenile Delinquency Improvement Program. I mean, it's kind of similar model, hopefully will be modeled after what April was just describing around dependency, but this is specifically around delinquency. I don't actually sit on that, but we have directors on that co-facilitate that with some judges, and then we have a bunch of subcommittees, and right now they're looking at risk assessment for juveniles involved with courts, and just whether or not there should be like a standard way of doing that across the 36 counties in Oregon, which will be interesting to see what comes out of that. Maybe even looking at like some sort of matrix. There's talk around that, but it's staffed by the judicial department, and so they come to our meetings and give us updates. But so that's kind of something separate, but we're part of that. Yeah, for Oregon Juvenile Department Directors Association, I mean, just a lot of stuff going on, legislative stuff working on, which I think will be in better contact with SOCAC around where we cross over. We, meet monthly, we have quarterly full membership meetings. And of course, some of our close state partners are part of those meetings as well, including Oregon Youth Authority, Oregon Youth Development, and Oregon Department of Education attends those meetings as well, where we intersect for like our juvenile detention education centers. Yeah, I think some of the big things that we're working on right now is just in partnership with Youth Development Oregon, just updating the juvenile detention guidelines. And we've had great representation from SOCAC in that work, so that's been fun. And then also for 2 years, we've been working on a complete overhaul of the training for all juvenile justice professionals that OJDDA puts on, which has included like a full review and assessment of all training using a curriculum review for bias content, and then updating it and rolling that out as it slowly gets updated. And then, of course, substance abuse disorder resources has been a big topic in our meetings, just trying to fight for resources at the state level to ensure they include youth. So far, that hasn't been very successful. It usually leaves youth out. And then also just, the last session, there was the establishment of the Juvenile Justice Policy Commission. So we do have 2 juvenile directors on that, and they're just kind of in their early forming stages, but I think that's going to be an interesting committee that will be reporting back on how we decide juvenile justice policy in the legislature in Oregon. So off the cuff, that's what I have.
Quite a bit. Thanks so much, Sonia. Are there Alicia's not in the room right now. She had to hop out for another meeting. Are there other council members who are working on stuff that's council connected that you're like, we never talk about my thing? There's a lot of cross-pollination we could do better moving forward.
Got me on the list there. Do you want me to talk about the jurisdiction committee?
Yes,
Okay.
Please. Sorry, I skipped you. I was bouncing.
That's okay. No need to apologize. So House Bill 4086, which came through, required child welfare to do a couple of things. The first is to work with a group around supports and services to youth with problematic sexualized behaviors. And the second piece was around jurisdiction in child welfare cases. I am not an expert on problematic sexual behaviors, and so I'm not on that group, but I am on the jurisdiction group. I have some experience with that. And So the goal of that group is to look at the child abuse investigation processes, and then provide recommendations around that reflect desires of the community, child welfare staff, and system partners, in using actual like research and data around safety, equity, and family support, hopefully with the end goal of strengthening children and families in Oregon. And so child welfare's investigation process, for those that aren't familiar, is very confusing and complex, and sometimes nobody's quite sure who's supposed to investigate what because it is so complex. So we're trying to do a bit of streamlining of those things. So we've had 2 meetings so far. We're meeting every 2 weeks. Oh gosh, I forget, for maybe almost a year, I want to say, to come up with this set of recommendations and suggested adjustments to some of the way that child abuse investigations are done, up to and including definitions of abuse, because I believe those live in multiple places in Oregon state law at this point, which seems kind of odd just on its face. So that's exciting. The other thing that I would just like to say is we talk a lot about workforce issues and behavioral health in this space. I'm lucky to be a board member of an organization called the Oregon Child and Family Center for Excellence. They have worked with Cambia Health and have a grant for a behavioral health workforce classroom, which is at Sunset High School. They were recently featured on KGW. I'll drop that link in the chat. It's pretty cool stuff that Vera Stolul and that group are doing. You know, I'm honored to be a member of their board. Really looking at introducing high school youth into the behavioral health workforce and getting them prepped and prepared to understand what that workforce looks like. So pretty cool stuff.
Awesome. Thanks, Adam. And then I'm seeing from Jill Archer in the chat, question about whether this group is aware of the carceral benefit that will become available in 2026, which includes youth. And I don't know that answer, but Jill, why don't you go ahead? Do you have enough information to tell us about it?
Enough to be dangerous. It's part of our waiver. We just got approval to include, we had to negotiate what the benefit would include, but it's it'll go live in 2026, and it's basically coverage. This is the part I'm not remembering. I think it's up to 60 or 90 days in while someone's incarcerated, that they'll have a limited Medicaid benefit and be able to do like get connected to medication, basic health screenings and care coordination, so that they're already on Medicaid when they leave a carceral institution. And so that includes like juvenile detention, Hillcrest, like the OA facilities, as well as all of the jails for adults. So there's a lot of work being done over the next year to partner with those carceral settings to make sure that they have the infrastructure to be able to deliver like what's covered under the benefit, either internally or contract with someone to do it, and then be able to get reimbursed from the CCOs for the Medicaid covered services. So it's, I mean, we've been wanting this for a really long time, so it's like a really big deal. I don't have the specific details of what's covered under the benefit, but I'm sure that we could have someone come and share that with this group if that's of interest.
Thanks, Jill. Executive committee members who set the agenda for these meetings, put a pin in Jill's offer to bring somebody to talk about the carceral setting. And then Emily Cooper is asking for Ebony or someone else from the Oregon Health Authority, any updates on the OHA's recent housing support and whether it applies to youth as well.
I wouldn't need to get detail around if it applies to youth, because I think it's a good question. And I think, you know, depending on the situations, I think about if a youth is emancipated or the youth was in independent living, so on and so forth. But that's some information that I can bring back.
That'd be awesome, because I think it's so cool that OHA is doing it. And I definitely think, you know, everyone here would love to hear. I know it applies for adults. I just didn't know if it applied for youth. So thank you for looking into that.
And Corinna, if you can put that in the notes, we can remind Ebony after the meeting, since she's driving, it would be unsafe for her to make a note of that. Okay, so we're over time on the agenda, on this agenda item. I think it's clear we have a lot of wisdom and a lot of good work happening in the room. So I'm hopeful that we can keep doing sort of cross-pollination updates. And if you have suggestions on how that portion of the agenda could be more effective, maybe it's a small group and then we report out, or I'm not sure how we could do that, but I would love for you all to be aware of what each other is doing and how we can kind of cross-pollinate one another a little bit better than we have previously done in this space. Next slide.
I'm up, I think.
Yep.
So, okay, we're short on time, so I'll be brief to get through this, but please don't hesitate to stop me if you have questions. So there is a lot of opportunity for System of Care Advisory Council members to get directly involved in rule changes that have a lot of impact on the family and youth we're here to serve. Rules can be kind of dry, but if they are done poorly, have pretty massive downstream impact into how programs actually get rolled out. So we've got several opportunities. First, OHA is opening up the intensive in-home behavioral health treatment, so IIBHT rules for changes. We have been invited to share our suggestions about suggested changes. If you want to review a copy of those changes, the draft changes, and meet for like an hour, 90 minutes to discuss suggestions, please raise your hand now, your virtual hand, so that we can get a list of folks together. So again, this is a pretty intensive outpatient mental health level of service that is fairly new to Oregon and has had a mixed start or rollout, I guess. And so it rolled out during the global pandemic. Like, it's had a lot of interesting rollouts, but we have some adjustments. Who wants to engage in that? Or is it just me? Okay, thank you.
So Carissa wants to know how soon will these meetings occur. So Carissa, there's going to be a public rules advisory committee process that OHA will host probably in December, but we are we have a draft of the changes that we have the draft changes. And we asked, hey, can the SOCAT get together and have a little kind of side conversation about sort of our suggestions for how these rules would change? And they said, sure. So what I was thinking was we'd call, you all raise your hands. I send you a copy of where they're at right now with the draft changes. You read them. Then we come together for 90 minutes and talk about what we like, what we would change in those draft changes. And then we send that to OHA, and that's sort of part of their public engagement process. It doesn't mean if you participate in this conversation, you wouldn't be able to participate in the public, more structured rules advisory committee process. I'll be honest with you, I find it really hard to participate in that public, really structured process. And so this is a way to sort of open up a little less rigidity so that we all can kind of talk and through the changes and understand the implications and then make some recommendations as a council. I don't know if that answers your question, but so one night meeting is the commitment.
I just have limited time in the next few weeks, so I didn't want to volunteer for something I couldn't do.
Another question, Allison Stark was asking, can we suggest one of our staff? Does it have to be a council member, or can they provide maybe someone who's more steeped in those rules day to day to participate?
I would think so, because the legislative committee has people who are not on the council, but who are representing other people. And I know for me, I'm not going to be the expert in the IABHT rules, but I have people who on my team who I think would be great.
So I saw Jackie Serrano had her hand up, even if she didn't mean to. I'm going to say she gets to be involved.
I'll do it only for you, Adam. But yes,
she knows
I'll do
this
it.
stuff. So I'm gonna voluntold her. If not, I see Allison will maybe bring an individual from your team. Okay.
Yes, that's happy to do that.
Right on. Maybe Robin as well. We'll tag somebody from your crew. Robin, is that accurate? Okay. Looks like Andrew Grover has been volunteered as well by Robin, so he should be interested. I'm sure he is. So okay. Any others? All right.
Okay.
Okay.
I got it written down. I'll be in touch.
Okay. Okay. I think next is to call together a membership review committee to recommend appointments to the governor's office to fill the empty local mental health program seat that Amy Baker recently vacated because Amy joined the governor's office. And the open youth seat if we have any current applications. Again, looking for volunteers for that. I guess that's maybe a couple hours of your time. Raise your hand if you're willing to review those applications. You can review those applications on your own, and then occasionally there's a brief meeting to kind of debrief together. Is that correct, Anna?
Yep.
Okay. So it looks like we've got Allison, Annette, Robin, and Carissa. That good enough, or you need any more?
That's good.
Good. Look at us moving through these things. All right. Okay.
Christy is the one who has the update.
Yeah. So Christy, you got an update on surveys.
Yeah, real brief. Just wanted to make sure you all saw the email that went out last week. I think there was another reminder earlier this week about a survey that SOCAC is putting out to families and caregivers. This is in partnership with Oregon Health and Science University as part of the big assessment that we're doing. We are looking for information about experiences family members have with accessing informal or natural supports. This is an area of data that we don't really know a lot about, so we're going to do our best to collect that via survey. There's also opportunities for folks who take the survey to also participate in a follow-up interview with OHSU. We're only going to have time to keep this survey open for a couple of weeks, so really relying on all of our partners to help get that survey out to families and caregivers. So that could be personal people that you work with. That could be ways that you can share that through your organization's social media or newsletters or whatever way you can help get the word out. It is a compensated survey. $20 gift card is being sent out to everybody who spends a little bit of time providing and sharing their experiences. So I will send that out again in the digest just to make sure you all saw it. And if you have any questions, please let me know. We are going to be putting out a comparable survey to youth specifically. That will probably go out sometime next week. So there'll be another round of emails. Again, that one will be going out specifically to youth. So keep your eyes out for that as well.
All right. Questions on that? Seeing none. Robin, it's November. It's about that.
It's November. And what do we love
legislative.
about November? Well, today's the last day we're going to have election commercials. I don't know if anybody's as excited about that as I am, but I can't wait for those texts to stop. However, we also have some legislative concepts that are coming back. The legislative committee has been hard at work reviewing legislative concepts from a variety of different agencies, and our own 2 concepts are on their way back in. We have the one concept that we're going to review at the November 20th. It's November 20th SOCAC meeting. That's for what has been referred to as the one that we've been working on with DHS. The second legislative concept that we have is about our committee structure. So we're going for 2 additional family members and 2 additional youth members, increasing the number of individuals on our committee. Yay! More work for the membership committee to be thinking about, raise the roof, and be thinking about who you want to invite to the table. And that bill also will provide some permanence to a couple of our staff positions, which right now are temporary and we need to make them permanent. So we're very excited about that bill. We know that we have support for that. And hey, if you want to come to a legislative committee meeting, you are always welcome. We've got some really great stuff coming up. I think we're meeting tomorrow at 8:30, aren't we? Yes, we are. All right. I think that's everything. Thanks, Adam.
Yeah, and just a reminder that space is not necessarily a safe space, but a brave space. Is kind of how we frame that, because the legislative process can be a little messy. for those of you who do that work on the regular.
And if you have legislative concepts out there that you think the legislative committee should hear about, please reach out to me or Anna. We can get you scheduled. We may not get you in by the end of the year, but we will get you in before legislature starts. So we would be super excited to hear about that. Thank you. Sorry.
No, you're all good. Anna, budget update.
Just wanted to set the stage. So we had been talking, I think, in a couple of our different spaces about the SOCAC, and has historically never been able to spend all of our money. We have done some creative things where we did the $38,000 for Agile funds. That's what Selby was referring to at the very beginning of this meeting. Some really cool seed projects. We gave some money once to Youth Development Oregon because they had a really robust grants program. I just want to set a clear expectation that that is no longer the case. The SOCAC will likely be spending ourselves almost down to the penny when it comes to our budget for the 23-25 biennium. We have a little bit of money left for some strategic planning investments that are clear as part of the plan that the strategic planning core team is making around bringing in some folks who are trusted communicators for priority communities that we don't have relationships with and trying to kind of facilitate relationships there. But I know that we'd had conversations about like, oh, maybe we could contract for the PCG study to apply to children. That doesn't mean that won't happen, but the SOCAC won't be paying for it. So just wanted to give clear expectations that we don't have extra money this time around, and that's new for us. So progress in that we are managing our budgets a little bit more like a mature body. And also don't imagine that we have sort of some fungible cash sitting around that we can go ahead and spend on something because it ain't there anymore. That's all I wanted to say.
Spending down to the penny. All right. I think lastly is just for folks, there's a Oregon-based conference led by the Oregon Alliance. They have an annual conference. It's in April this year. It's at Salishan from April 9th through the 12th. Our lovely executive director, Anna Williams, has been asked to provide a keynote at that conference. And so, Anna, is there anything you want to tell the council about this event?
I think we'll have more announcements coming. The council is invited to be very involved in this year's annual meeting. We're still kind of working on exactly what those details look like with the Alliance, so I don't want to get out ahead of them on any kind of messaging. But keep your eyes open, and if you like Salishan or if you like sitting on panels, you may be invited to participate in one way or another.
Cool. Any other council members or staff have any quick announcements for the good of the order?
A question about the conference. Are session proposals closed already?
I don't believe so.
Okay.
But we can ask and communicate that out.
And they're coming. They're after our break. They're Kitty and Vera are our next speakers. So if we have time in that moment, Allison, you're welcome to ask too.
Cool.
All righty, break time. Time now is 2:24. We taking 10 minutes? Okay, we'll see you back here at 3:35.
2:35? 2:35. Don't take an hour and 10-minute break, please.
I was like, too good to be true. Okay. Thanks.
Calling folks back into the room.
For folks, yeah, okay, thanks, April. Yeah. For council members, if you're able to come back on camera so I know that you are back, and if not, if you could maybe just throw in a some sort of emoji into your screen, so there's some sort of sign of presence. That would be great. Thank you, folks. Okay, thank you. All right. And I'm looking, do we have, thanks, Grace, appreciate that. I like the enthusiasm. Do we have Vera and Kitty here?
I don't see them.
Yeah, that's what I was thinking as well. So do we, I see Katie's here. I know she's next and she's got an hour. So it may be that if we don't have Vera or Kitty, we jump forward a bit. I don't know. Sorry to put you on the spot, Katie. Are you available if we're ready for you now, or are you in 2 meetings at once because you're a busy person?
Nope. Can you give me just like
Yeah, absolutely.
seconds?
Yeah. Take your time. We'll see if we can get Vera and or Kitty here. Wow.
Yep. I'll try and work on that right now. And Adam, I don't know if you can text them as well. I'm sending them the link again right now.
And they aren't in the waiting room. Nice. Done that. Yeah. Okay. I think if we are if Katie is available, let's go ahead and just move to Katie, and then we may get out of here a half hour early. So I don't want to step on your toes in that because you were intent to introduce this one, but you okay with me just doing it since I've already got the mic on? Yeah, okay. So Katie Beck from OHA's Medicaid division is here to talk to the council about the Medicaid Steering Committee. It's called the Medicaid Operations Coordination Steering Committee, and its connections to the work of the System of Care Advisory Council. So we've got an hour for this, and thank you, Katie, for being flexible. I'll turn it over to you.
Yeah, happy to. Let's see here. Can I share my slides with you guys?
Are you seeing the green share sort of in the middle of your banner at the bottom?
Mm-hmm.
Then you should be able to.
Okay. All right. Are you seeing this okay? The Medicaid Operations Coordination Steering Committee? Okay. Well, hi, I am Katie Beck. I'm a senior Medicaid analyst with the Oregon Health Authority. I sit under the CCO Operations Division. Sorry, I was trying to get a little bit of lunch before this, so my voice is taking a little minute. So I'd like to just share some general information around how the MOXIE, as we lovingly call it, came to be, and sort of the vision and how it intersects or can intersect with various committees and governance organizations to help us do a better job of serving the Oregonians that we're here to work for. And then I've invited my colleague, Kalina, to share some information around the Medicaid issue resolution log process as well. And then we have some time for conversation. So the MOXIE gets its authority through a variety of federal agreements that we've made and state statute, as well as our interagency agreement. So this is probably more information than you ever wanted to know, but just to provide you with a little bit of context around the obligation associated with the MOXIE. So the Medicaid Operations Coordination Steering Committee, or MOXIE, was founded out of our agency separation out of ODHS. So this is going back a few years. So it is our checks and balances to ensure that we're providing oversight and monitoring of the delegated authorities within Medicaid that live within ODHS. So in April, when I stepped into this role, I wanted to take a little bit of time to kind of just test the water, survey the landscape. You know, as we come and go in our careers, we want to leave space, or I wanted to leave some space to recognize that things change, people change, and so it was I had the opportunity, I would say, to take several months of just listening, having some one-on-one conversations, joining team meetings or various topic-focused meetings, and learning what where we have opportunities to do better and partnering across our agencies, focusing on ODHS and OHA Medicaid. So as part of that, I joined the MOXIE meetings that were occurring, and it became clear that we had some opportunity to align MOXIE with the requirements that are placed on the meeting, as well as to look at where our opportunities are to do better. So we developed a crosswalk of all of those regulatory requirements as our starting space, so that we're making sure that we're hitting the obligations, and going from there. Went through several iterations of internal proposals, reviews, input, and then we started to look at the various committees that exist, because we don't want to duplicate work. We want to leverage the good work that's being done elsewhere, and where folks are raising the flag and saying, hey, we know there's a problem here. We want to listen to that and just collect a broader set of insights into the work that we prioritize and move forward with our limited resources. So that will always be a work in progress. It's certainly not a one and done deal. I am quite confident that there is a bunch that I don't know, and there may be other committees that I just simply am not aware of. So this will grow and change over time. We launched our first quarterly MOXIE meeting under this structure in October, and are collecting some feedback on that right now to help inform the changes that we make for our continuous improvement efforts to make it an effective and efficient venue. So the purpose of Moxie is really centered on our multi-system involved populations, providing some oversight and resource prioritization around OHA's medical assistance programs, also known as the Oregon Health Plan. Moxie is being redesigned to increase the transparency and collaboration across our program areas for just more efficiency, better relationships, and ultimately more effective and meaningful outcomes for the populations that we serve together. We're going to use this venue to take in information, feedback, and data that reflects need, utilization, or risk to our multi-system involved populations enrolled in our medical assistance programs. I really want to center this on being, a strong foundation of data informed, capitalizing on a broad set of input. So we're putting together the pieces of how our decisions or our gaps are impacting the populations that we serve. So as topics are prioritized and resourced, which I want to stress, we're really good at prioritizing everything. And then the reality is that nothing is truly the priority because staff just aren't magic. So by tying together the conversation around resourcing and prioritizing, it sort of forces the issue a little bit more thoughtfully so that we're assigning, clear work groups with a dedicated scope, timelines, objectives, deliverables that they will go and work on and then report back to the next quarterly Moxie on the updates. In addition, we built in a structure to support leadership decision-making as needed and, raising the flag when there are risks to the work or to our compliance or to the populations that we're trying to serve so that leadership is aware and able to intervene as needed. Part of this is building the foundation for strong systems and processes for effective communication. So, when we all, win the lottery and go to a lovely beach somewhere warm, there is solid documentation and systems and processes in place to keep the work moving forward effectively. So the scope of Moxie is quite broad. When we think about this from a historical context, when our agency split, it was pretty slim, the delegated authorities that remained with DHS, with ODHS. Over time, that has grown pretty dramatically. So the topics based on our requirements set forth between CMS and state law includes, state Medicaid plan amendments, waivers, when there's federal guidance that's coming down that might impact our shared populations or programs, legislative actions, when there's updates or revisions to our Code of Federal Regulations that kind of sets the rules that we have to play within, and administrative rules. Includes program oversight, audits, program development, when there's legal actions. We have added into this, to call out for reports and the issue resolution log and the cross-divisional proposals. One of the core requirements of the Moxie is to maintain the interagency agreement, which is one of the first things that we're tackling is to do updates on that and ensure that it is current with the operations of our programs and the coming changes that we are aware of that are coming down the pike from the federal government. So out of scope for Moxie is where there are other, like really trying to focus it on not duplicating work. So where there are other bodies or committees that are dedicated to a particular topic, we don't want to duplicate that. We want to create the relationship so that we're aware of that work, and where Moxie members feel like they need to have a greater level of involvement, they can raise their hand and join that conversation. And there's a broad awareness of it so that we're not trying to solve a problem that somebody else is already trying to solve. So this can include also it's out of scope or case specific issues, things that should follow a complaints process or a case staffing process. We really want to focus on the systemic issues that impact the broader set of populations between our shared agencies. Implementation of new laws, federal rule, programs, or services are out of scope for Moxie, although Moxie is a good clearinghouse across our state programs to connect with updates. Once those are implemented, then it would become within Moxie's scope to provide some monitoring if it's within like the joint program ODHS and OHA populations. Where there are oversight activities that need to occur. So say somebody's raised a flag, we've done our research, we are able to demonstrate that something is a compliance issue that needs formal compliance action, that will move into the compliance process appropriate to the agency and division that owns that body of work. Does somebody have a question?
There's a question in the chat. How is this different from what the Medicaid director and their team would oversee?
So I report to the Medicaid director as well. And so this is, it is a part of that structure. Here, this kind of shows you the structure. Maybe this is a good answer to that question. So as part of this work, we have created a structure where every month the Medicaid director and their deputies meet with the ODHS program directors and their deputies as part of an effort to build relationships, share information, have some like joint discussion to understand where we need to focus our priorities and impacts to the shared populations at the leadership level. It's also our avenue to highlight or escalate where we need to have some decision making or raise a risk. So Moxie is kind of like, we've got the directors. Moxie is sort of that next level down where you have the managers that oversee the program staff that are doing the work. They are really kind of keyed in on what the actual staff resources look like in real time. So we take our policy directive from the directors, and then the program managers, really look to do the body of work with their staff that brings that to fruition. The core membership is centered on, OHA Medicaid program areas. So, the coordinated care organization, operations division, Medicaid policy and fee-for-service operations, behavioral health, child and family, adult mental health addictions. We've got strong collaboration with OPAR, the Office of Program Integrity. I apologize for the use of acronyms. I'm trying not to, but please feel invited to call it out if I am not catching that. Each of the ODHS program areas, so like child welfare, Oregon eligibility partnership, public policy and special projects, vocational rehabilitation, that has been a new one for us to be engaging with. And so there's a lot of opportunity there. that we have on both sides of that coin. So it's kind of exciting and a lot. You know, Aging and People with Disabilities, Office of Developmental Disability Services, Oregon Youth Authority. We've reached out to the Department of Education, and hopefully we'll get some you know, engagement in that as topics are, you know, important to them as well. Did that help to kind of answer the question of how this is different, or do you have a remaining question around that?
No, I don't think so. I mean, essentially, it's trying to coordinate with the operating agencies as the Medicaid, as the CMS facing body. So you're trying to basically reestablish that order within the state.
Yep.
Okay, perfect.
That was very succinctly stated.
Thank you. I appreciate
Yeah.
it.
So the MOXIE meeting has moved to a quarterly cycle. I think we already talked about the core membership. It's really focused on program managers and leadership with the direct knowledge of and decision-making authority around the staff resources to do the work. Really trying to drive us to a place of making sure that we are resourcing our priorities. And if something is a priority and the resources aren't there, that we're escalating that to the directors, you know, through this other monthly MOXIE Executive Leadership Coordination meeting that happens between the program directors. The purpose, you know, it's creating the transparent collaborative systems across our ODHS and OHA programs, where we have some shared populations. We use this space to act as a clearinghouse for broad updates to increase the awareness of the work that's occurring across systems. I think that we don't know what we don't know. And so sharing the information so that, you know, our partners in the Oregon Youth Authority or in, you know, child welfare can raise their hand and say, hey, I think I might need to know a little more about that. Let's have a conversation and dig into it. Yeah, Emily?
Yeah, so I get, you know, that you meet to talk about in part the availability of resources and prioritization of the programs. Has there been is there a list now in terms of what resources that keep coming up as are missing or need to be built out more?
Well, we're not generating a list as the topics, the issues that are coming up that we want to prioritize, and it's being identified if there are staff resources. If the answer is no, then it goes to the directors, and the directors can make the choice about whether this is something that we need to look at, you know, using a pot of funds for a contractor, or do we need to do, you know, a pop in the next session to ask for staffing? Or is this something that we need to reprioritize work that our staff are already doing? So maybe something is, you know, falling off or falling down the ladder a little bit. So it's not, I wouldn't say it's as clean cut as a list that's being generated. I think it's kind of situational. So the Medicaid issue resolution log, Kalina is going to share a little bit more about that in a minute, but just at a high level. This is this process has been around for years. I think it was created with you know, Pat Allen, just as a means to identify the problems that exist in our system, so that we can not lose track of them in our emails or as staff, you know, come and go, but begin to, you know, do some systematic fixes to them. So we're using this this mechanism that has already existed for years to be an entry point into the MOXIE structure for decision making. So when somebody enters information into the Medicaid issue resolution log, it goes through a series of different reviews. So the first is this a systemic issue, or is this just a complaint or a case specific issue? Does this live with OHA Medicaid or impacting our joint populations? And if not, then it gets shuffled to the correct place where it should live. The staff that are managing this work will work with the submitters to better define. I think folks recognize a problem, and the language that we use matters. So they act as that intermediary to help us understand what the problem is, and then it can move into the MOXIE structure for a prioritized conversation. As we're standing this up, we are trying to identify liaisons between the various committees so that we're not duplicating work and we're creating some transparency across our systems. So for example, with this meeting, connected with Anna and Christy Hudson. And so we've invited them to join our monthly meetings to kind of talk about what's coming up on the next quarterly MOXIE and make sure that we're staying connected there. And then I will hand it over to Kalina. Are you on? I know we're a little early still for her.
Oh, need to find the unmute. I am here.
Thank
Well,
you.
I'm going to request the remote control from you. So that way I can easily just click forward. That's okay.
Yeah.
Perfect. All right. Hi, everyone. I'm Kalina. I am a process improvement policy analyst over in the Strategic Operations and Improvement Office over at Medicaid. And so I am one of the two individuals who work on the issue resolution log. I also have my counterpart, Amanda Braxton, here. So she might pop in every once in a while to answer some questions as well. But we are a little duo who run the issue resolution log. All right. There we go. So just to recap on what Katie just mentioned, oops, went a little too far. See if it goes backwards. Okay, hopefully this stays now. But as Katie mentioned, it is kind of a 3 threshold process. We get a lot of issues that come in, either we submit them individually, like Amanda and I, based on conversations that we're a part of, or other individuals across the agency are also able to submit any issues. So we can hear these in different regular meetings, advisory councils or committees, quarterly meetings, reports that come through. We'll document a lot of the issues that are in place there and then put them in our log. And so we'll work with different teams to just review what's going on with that issue, develop a problem statement, identify the impact, what communities are being impacted in this, and how far of the reach that is. And then depending on what things start looking like and who's all involved, we'll end up bringing it up to MOXIE. We do have a lot of other pathways going on, especially in the Medicaid division. And also to really call out, this issue resolution log is specifically for Medicaid and OHP. I want to make that very clear on that part. And so any issues that come up, if we need additional MOXIE support in the resolution of those issues, we will call upon them and bring forth those issues for agenda setting. All right. Hopefully we can move slide forward. Maybe. Okay. So why systemic issues matter. So this little infographic kind of helps illustrate what's the difference between a complaint and a systemic issue. Complaints are these individual or small one-time occurrences. Often they're pretty temporary, but we have a whole other team that works on these complaints. Once things are reoccurring or they're impacting a lot of people or groups, they'll turn into systemic issues, and that's what we start dealing with. So you can think of a systemic issue, an example as like multiple providers across regions experiencing delays in Medicaid reimbursements due to outdated billing systems. So hopefully this little example and this little infographic can help you kind of understand what is an individual complaint and what are systemic issues. And systemic issues are really important because a lot of people can be involved and it may impact a lot of different departments or agencies or programs. So we want to make sure everybody's represented and heard, and we can nip the issue in the bud easy as possible. Excuse me. All right. So to submit these issues, we have our systemic issue submission form, and there's a link there. And let me find the chat, and I can put that link in there too. But this form captures a lot of important information that encompasses a lot of different areas of your issue, including who does it impact, any work that's already been done, any potential solutions you may have, what kind of community engagement you've done, a whole gamut of different things. So we can understand what's really going on. And so when we have our first introduction meeting with you, we know we have a good sense of what's happening. This also helps us differentiate whether this is actually a systemic issue, or maybe we have to bring you over into the complaints area, or maybe you need a different approach than our systemic issue process. I see a question. Does the IRL include issues with the one eligibility system and people working on that? Amanda, can you actually pop in really quick and answer that question?
I'm trying to think through it. Does it include the one eligibility system and people working at one eligibility customer service? Yes and no, primarily yes, because we do work, we don't have much control over the eligibility piece, but if it has to do with like CCO enrollment, we can help with that. If eligibility is interacting with CCO enrollment or interacting with other systems that impact our piece of the work. But if we were to get an issue that it doesn't impact our systems, we would forward it on to the one eligibility system folks.
Thanks, Amanda. I really appreciate your help on that.
Welcome.
All right. And then, so that's a submission form, and I'll put that link in the chat. Anybody wants to submit any issues. And then we have the issue resolution log, or the IRL. So also not to get confused with the term in real life or using that acronym, but the issue resolution log here. Sorry, I have to throw in a little joke there. So this is what Amanda and I use and Katie uses to track all the issues that come in through that issue submission form, and any issues that we put in manually. Like Katie said, this is our way of ensuring that things don't get lost in an email. We can keep up with everything, but also it's a way for you all to kind of see what's going on. We hope to have more of a user-friendly version of this on the OWL somewhere, where you can be able to look at all of the issues and be able to come in and interact with them and help us kind of solve them as we go. So stay tuned for more details on that. But the issue resolution log is where we keep a lot of things and try to keep up to date and keep on with the status of each issue. So a lot of that same information from our form gets fed into this log. All right. After our question before, a different meeting, I really want to touch on our issue impact assessment. So this is a pretty minor level of way to look at our equity impact. We take into account operational impact and equity impact for each issue that comes in. And so we'll look at how many partner agencies are impacted, operational impacts. We'll look at any OHP health benefits and impacted populations. And so the way we kind of do it right now is just each thing in each of those areas or each item gets scored 1 point. So the more points or more areas that that issue is impacting, the more important that issue is to be followed up with and make sure that leadership attention is on there. We're sending it over to Moxie and so far and so forth. So I just wanted to touch on this just very briefly of like how we kind of assess impact. and how we kind of prioritize things. All right, let's go over a little example. So we're going to do language barriers as a systemic issue. So think about Medicaid members who speak languages other than English. They may not be receiving important notices like their coverage changes, benefits, and appeals in their preferred languages, which is creating a lot of confusion and delays in their care. And so we'll look at the impact and we'll see members, okay, they're lacking the understanding of their benefits and they may face some delays in their receiving care. Providers may see some struggles there too, with people missing appointments, and the Medicaid system overall, there's increased costs and inefficiencies from delayed treatments and increased administrative burden. So because of all of that, a lot of these current processes do not provide enough language access, enough adequate language services, leading to a lot of barriers for non-English speaking members. So some suggested solutions that we can come up with and we'll work with teams to come up with, and these are just examples, is coming up with a comprehensive language access plan or automated translation services or member feedback and testing and culturally and linguistically appropriate services, standards compliance. So we can work together to build a problem statement like that in the description and help teams work towards suggested solutions. And all of this together gets put in our log so we can track it and see how things go. And we can utilize this information to help escalate to leadership, to Moxie, to continue to gain support on each issue. And then, yeah. So if anything, just to take home here, issue resolution drives action. A lot of this stuff that we use helps track issues and progress on all of our issues. It helps us create efficient follow-up and resolution. We can identify patterns and so on and so forth. So if anybody has any questions, I would be happy to take them. And if anybody needs any more resources when it comes to issue resolution, whether it's examples, templates, or just additional training on this, I'm happy to meet with folks and discuss this any further. So yeah, I see a hand, Emily.
I have two questions. First, have you seen any trends in the issues that are tracked in the IRL? And then is the IRL or will the IRL ever be made public?
Yeah, those are great questions. So we do see some trends. So as issues come in, we try to sort them into buckets of what areas they're most impacting to, sorry, my cat is trying to get on my desk. I apologize for that. It's one of those evenings. So when issues do come in, we try to track them and put them in buckets. For example, that language access issue. Right now in our log, we have 3 or 4 different issues. So we're able to track some of those trends just to see how many of each issue is kind of pulling in different areas. However, for general trends, we don't have the data for that, unfortunately, unless Amanda, you can think of something that is not on the top of my brain for trend tracking there.
Well, or buckets, like whatever you guys categorize, if there's anything you're noticing that keeps coming up besides
Emily, we have about 15 buckets that we're kind of reviewing as issues come in to fill those buckets. And then as those buckets get heavier, then we bring them over to the more active working and elevating those conversations. And about the public, the issue log, I don't imagine will ever be public. I mean, it's all public information, right? But it is generally public through the Ombuds report. A lot of the issues that we collect, we share that data to the Ombuds program, and then they review our data, they review their data, and they choose which ones to kind of be more public about.
Thanks, Amanda.
Thanks, Colleen.
Of course.
As part of this work, this team has started to integrate the content received through the SOCAC report into the issue resolution log as well. And I want to stress that this is standing up a new process within Moxie to support this work. And so we're going to learn some hard lessons throughout it, I'm sure. And not everything on the issue resolution log is going to be tackled on the timeline that we may want it to be tackled, simply because of, you know, resource limitations or competing priorities. It does provide us with that avenue to make sure it does not get lost in somebody's email or, you know, fall off of the plate. Go ahead, Anna.
Thanks, Katie. My first question is, do you mind if we pull the slides down so that I just think some of the question and answer period goes a little bit better when there's more faces in the room. Thank you. And then my second question is kind of the IRL issue resolution log feels similar in a lot of ways to the System of Care Advisory Council barrier resolution. Ours is not specific to Medicaid, right? But it has some Medicaid issues that get elevated. And so I just wanted to sort of like tie that that similarity together for some of our council members who may be watching that resolution process and maybe hadn't. I mean, I don't know if we could elevate an issue to the IRL if it's a Medicaid issue. Like, what would that look like, Katie?
Yeah.
Whoever is the right person to answer.
This is all bags right here. Like bags and bags.
So I
got some squeegees.
Sorry, train of thought. The issue resolution. Okay, so as the content comes in and you guys are identifying it as a systemic issue, submitting that through the form into the issue resolution log is like, it's such an awesome head start for this team, because you guys have already done the work that demonstrates that this is a systemic issue. At least the ones that I have seen just through my own eyes. So I feel like that is such a great start into that work. It would be a means of getting it into Medicaid for action to start happening. I think that Medicaid is a big entity, and sometimes it can be really hard to find the right person. And so we wind up with best of intent folks trying to work on something that maybe they're not quite sure about. This does a nice job of helping to make sure that we're making those connections. Amanda or Kalina, do you guys want to, I don't know, give a more eloquent answer than what I just gave?
I was trying to answer questions in the chat.
Oh, okay.
I mean, you said it perfectly. So yeah, if you have any issues that come up that are relevant to Medicaid, or you think that are, that need to be on the issue resolution log, just send them our way, and yeah, hopefully we can collaborate more.
Yeah, we definitely don't want to undermine or disrupt the great work that happens out of the system of care and all of the work that you guys do in that. I think we'd love to take that good work and you know, once you hit that point where you're like, yeah, this is definitely a systemic Medicaid issue, hand it off to us so we can go and do that internal work that needs to happen.
I think that feels great to us, because sometimes we hit that this is a Medicaid issue and then we're like, I guess we'll tell Emma and see if there's something she can do, right? Emma Sando is the Medicaid director, but with this structure, there's a way to put it on a list and know that you're evaluating it, right? Like, it feels good for me personally to be able to like, I can't fix this. Here you go, team, and see what you all can do with it. So hopeful that there's a good layer there and not a conflict.
Yeah,
I think so. And to be quite frank, having that external pressure is a really great way to help move things forward within state systems. I wouldn't say that that's at all unique to OHA or to Medicaid. But let's see, I'm not sure if Allison or Christy had your hand up first. So
it would be Allison.
Okay, thank you.
So, and correct me if I'm wrong, but I guess the way I kind of see, I mean, I assume part of the reason you guys are doing this is that you have CMS requirements to actually have this system in place. So this is a little bit regulatory in nature, right? It's making sure you're following federal guidelines. You've got to make sure that you're addressing things appropriately. And so, I mean, and like I said, maybe I'm wrong here, but I think the system of care, Anna, to your point, is that we are looking at systematic problems in operational, like operations. And this is kind of more of the like structural piece. So I don't know if you guys would get super involved. I mean, capacity is one thing because certainly capacity impacts the waivers and the K plan and all, and and OHP generally, but it's a little bit, I guess, maybe once removed. Is that an accurate statement?
Well, I think that I would say it's once removed sounds right, but what I guess the way that I would frame it is we look at things from our respective lenses, right? So you may see that, just spitball in here, children and youth in child welfare's custody that are transitioning across service areas are not getting their eligibility timely, or their transfer of health information isn't happening timely, so it's detrimental. When that comes to us, we can look into that and see, is this a systems issue, like literally looking into the system, or we can say, is this like a process issue that's happening? Are our administrative rules not sufficient to meet the need? Is it a contract issue? At the end of the day, it becomes an issue that would be in scope for Moxie because it is negatively impacting our multi-system involved population, and it has the potential to run afoul of either our compliance with the federal government or a contractor's compliance, dependent upon what we find in that deep dive. So it's once removed, but I'd say they're sisters.
Thank you.
There was a question in the chat about Moxie committee members, and there's a website. There's no public posted website. It is surely an internal committee. I think I would need to think over that, creating a website for it before I did. Do you have thoughts?
Are you talking about Tristan's question about who are the members of the Medicaid steering committee, and is that list online?
Mm-hmm.
I don't know if there's any regulatory reason to either do or don't publish that list. I think from the sort of good governance perspective, like who's doing this work is something that is valuable to sort of share, right? Like for our barrier resolution process, we have a name within each agency of who's sort of the lead person on the barrier. And to sort of call back your previous statement, that puts a little bit of additional pressure on issue resolution. So there's a political reason to do that and a good governance reason to do that, and I'll just leave it there.
Okay.
And Carissa's hand was up before Alicia's. They sort of sort that way. So
oh, thank you.
Sorry, I might have missed this, but how do we find out if those things are overlapping? Like if we have submitted a barrier through the system of care and something's being worked on through Moxie, instead of going to the website for Moxie and submitting another issue, how do you find out what's being worked on? Does that make sense?
Yeah, no, that totally makes sense. So with the structure being stood up, we're trying to create that liaising relationship so that if there's something being discussed in the system of care, that the liaison with the Moxie, so like Anna, Christy, or if you ever want me to come back, happy to, can share an update on what's happening with that work. What I would say is, if you're like not sure, or you feel like something's not moving at an adequate pace, I would resubmit it. I would just make sure that that pressure, that external pressure, stays on the agency to flag it, and that we need to work through it.
Thanks.
Yeah. Go ahead, Alicia.
Okay, so I'll be honest, this was really, really difficult for me to follow. Not necessarily because it's like hard to understand or anything like that, but one of the things that just like immediately stood out, or almost immediately stood out to me, is that it's all internal. So it's system people reinforcing system-y things under the guise of knowing and understanding what impacted populations need or want, or need, I guess. So I'm struggling a little bit with this idea of not having community partners or community members on this panel, and then also it not being necessarily public, right? Like the link that we just got, right? That link wouldn't be public, right? Like it's not like anybody could just say, hey, I have this issue, and then send it to you guys, right? Unless, of course, they're how I would and forgive me, but I tend to be a little bit of more the cynical person. But if you're worthy of having access to this link, then you get it. All right, so that's kind of like my feeling that I'm getting sitting in this space right now, is that I, as a family member or a family rep, happen to have the privilege of sitting here today. And that's why I get access to this link. Whereas other family members or family reps who could provide some information to this process, or could file this form or fill out this form, wouldn't be able to. So it is dependent on people within the system to do it, right? Is that what I'm understanding?
I hear what you're saying. I think you highlighted a gap for sure. I think that this is it has traditionally been used as an internal tool.
That's what I
guess
I wanted to mention, that we're trying to use an internal tool that we used to use for just billing, like over billing and under billing and all that stuff, operational stuff. It started out as a bill, identifying billing issues, and then it progressed into identifying impacts on access to services. And then it primarily moved towards access to services. So it is a tool, an operational tool that's kind of growing and expanding. And we're starting with Moxie to grow and expand it to do more, interdivisional stuff. And now we have a vision of maybe expanding it out even more for more of a collaborative with community members. I'm not sure when, just to be very transparent, I'm not sure when it'll be at that point where we can bring it out that far, but we're starting here with Moxie, and I'm glad you brought that up, where we can start to envision something else.
Okay, and when you say access,
like access to services, Medicaid services.
Okay, because my question earlier in the chat regarding like, would this resolution process include the one eligibility system. Like for those of us who are accessing services, that is part of the access.
Yes.
So if there is a traumatic event or the questions that are being asked through this process are highly traumatizing. And then if the people working in that office don't know how to do certain Medicaid waivers. So earlier you mentioned, some of the other partners like ODDS or Oregon Developmental Disability Services, right? So there are some waivers that are attached to services, right? If the folks working in the one eligibility office and the system itself is flawed, which I have access, I know of several instances where it has demonstrated a flaw, and I brought it up to several system partners. But if the system itself is flawed and it then does not allow individuals or people or families to actually gain access to Medicaid or that particular waiver, then that's an impact that you have on access to services, right?
I would
So
agree.
I highly encourage you all, if we're looking at kind of that holistic and broad sense, is that I understand that your particular area might not be able to, tell one eligibility what to do, right? Because we still live in silos. But with this process, I'm hoping that there might be an understanding that if families can't get, or particularly youth who qualify for a waiver, if they can't get access to that waiver, or if families have to be put through an extremely traumatizing process just to get their kids the services, that is an impact.
Yeah, I think
Part of the access to services.
our system can certainly be convoluted. And so we're trying to partner with some of these other organizations like SOCAC, and the next step is to partner with the community, the CPOP Community Partnership and Outreach folks to begin to bring in some of those elements. If it touches on Medicaid, we can look into it, right? Like, so one system may or may not be that, right? Like the waivers may be Medicaid and we may be able to do something if it's like SNAP related or TANF related. By all means, like if you're not sure, submit it and we'll make sure it gets to the right place, but it may not be something that is within the sphere of Moxie's charter. I think that is a terrible answer to give, because like I think you did a really nice job of explaining that your the experience as a community member is very different than trying to well, I'd say it's problematic to try to figure out how to operate within silos. So I guess what I would say is you raise the flag through SOCAC, through OMSPUDS, through your community partner and outreach, the regional outreach coordinators, through your local CCOs, community advisory committees. We're really trying to create those networks so that we're collecting that input, and where it does appropriately funnel into something that Moxie can or should have some oversight roles in. We want to be capturing that. I think the hard reality is we're standing this up to be transparent. And along with that comes recognizing where we have gaps. You know, and not making false promises that we can fix everything immediately.
Thanks, Katie.
Yeah, go ahead.
Well, I just wanted, one thing that I thought that you all would touch on, and maybe I had to leave for a second, maybe you touched on it, and I missed it. Was the public outreach work and the sort of the kind of convenings and bringing DHS offices and local system of care coordinators, and right, some of that, again, sort of more outreachy work that is connected to Moxie, but maybe not part of. I don't know if that's something you're ready to speak to, but may also be relevant to the conversation you're having with Alicia, and also is very relevant to the System of Care Advisory Council.
That's fair, yeah. So I guess, yeah, I really did focus on Moxie's structure and kind of how it connects to the SOCAC for highlighting issues. Kind of complementary of Moxie is this other piece of work that I'm doing where we're standing up regional interagency CCO meetings to highlight or to bring together like the local CCOs with the local ODHS and community offices. So it, you know, the community developmental disability programs, the ODDS brokerages they contract with, vocational rehabilitation, local leadership, child welfare's local leadership, the self-sufficiency programs, aging and people with disability or area agencies on aging, so that there's relationships being built. They can develop processes that connect across our program areas, so that their frontline caseworkers that also have client contact are well informed and have some navigation tools to help the populations that they're serving directly. And where things do need to get escalated, they have those contacts and relationships with the CCOs to be able to do so. I think that in the absence of really strong relationships across all of those program areas, what we see is things that could have been solved more quickly or could have been a non-issue to begin with, escalate and cycle or like circulate when really it could have been just a phone call to the right person. And so we're trying to build that, stand that up, use kind of the, I don't want to say use, like leverage the great work that's been done through the SOCAC and highlighting those local issues that that you can work on, but then also the systemic issues that really are outside of the local sphere of control. So we want to integrate that into these regional interagency collaboratives, so that we're also collecting that input, because you know, quite frankly, there are some things that are like big systemic issues that aren't really within the local organization sphere of control to change. You might put a Band-Aid on it. That Band-Aid may or may not hold for a week, but really there is some heavy system issues that we have to address. And so it's kind of trying to stand that up without duplicating the work or the topics that are addressed through the system of care. So again, you know, we want to create some strong liaisoning relationships with that. This is still in the design phase. I've been collecting feedback from CCOs and from all of the local ODHS program areas and contracted programs leadership. The next piece of that work is to go through and crosswalk it and like sort them into the different buckets of you know, who do we roll out first, second, third, all that good stuff. I think that we're going to learn through the process and want to be very thoughtful to, take lessons learned through the SOCAC process, but be sure not to disrupt the SOCAC work that happens, because you guys are doing really good work. I think we can do better at closing the loop back with you guys on what it is that we're doing with that information. I remember connecting with Anna this fall, and learning about the issue that you guys have been raising around timeliness of enrollments. I was like, oh, wait, no, we've been working on that. So I think that this is like another place of wanting to do a better job of connecting back to folks who are raising the issues.
Thanks, Katie. I think that's helpful. So I just wanted, the reason why, I mean, we brought Katie in because the executive council said this seems relevant and connected. But the reason it seems relevant and connected is because it is an opportunity for us to find where the work that we are prioritizing is Medicaid specific. Moxie has more power to solve those problems than the SOCAC does. Moxie is federally mandated. Like, if you take Medicaid and Medicare in your state, you have to have something like Moxie, right? What it sounds to me, what I understand, and Katie, correct me if I'm wrong, what Oregon is doing is above and beyond what the federal requirement is, but a lot of what you're doing is really to meet that federal requirement of if you have Medicaid that is housed at one entity like the Oregon Health Authority, and you have Medicaid services that are housed at any other entities like child welfare, which is Oregon has, right? Office of Developmental Disability Services has some Medicaid funding, right? You have to have this operations and steering committee to sort of tie those entities back together. So that's the base, like that's what we are legally mandated to do as a state. And then what Katie and her team are doing is trying to take some of the cool things that have happened in other spaces and saying, how can we sort of replicate but not duplicate a structure that can be effective? And so it's in early days. It is just like, you all just launched this like last month or something, right, Katie?
Yeah. Yep.
Lots of opportunity for improvement over time, and wanted us to know that it exists because it is a partner. It is a new problem-solving tool that I think the SOCAC can take advantage of. And be really clear as you hear these conversations out in the community of, oh, there's a Medicaid convening happening, is, that is encompassing our local system of care efforts and not overlapping, duplicating, diminishing, or dismissing the good work that our local system partners are doing. So I've already heard this whole presentation because I was in that first meeting. So maybe it makes more sense to me because it was the second time around. But I just wanted to sort of, those are like the take home messages that I think are important for the council to understand, is like, how can we connect? How is there similarities? What are the differences? And how can, no offense, Katie, but how can this be a tool for us to be more effective in our own work? How can we use you?
I think that goes both ways, honestly. Like, we are an internal entity. And I think Alicia brought up a really good point around that. And so having, the added input, I think, is really valuable.
So I know you've already gone over the amount of time that we had you set for. We asked you to come for an hour. I don't know if there are any other comments or questions that council members have around this topic. Saw some folks come back on camera, so I didn't know if that was because you had like a burning Medicaid question that you wanted to share. Oh, darn. Okay, well, thank you so much for being here, Moxie. And if there are other questions that pop up into your head later on, it's easy to get a hold of Katie, so I can pass it over to her and she can pass it out to her team. If you have other, like, how do we resolve these challenging issues, questions that come up later. And I guess Adam or Annette, I don't remember who's next up, but maybe we just move into public comment.
Yeah. And thanks, Katie and crew, for coming. That was some serious internal nuts and bolts of Medicaid stuff. like good, all good. I'm glad it exists, and yeah, I understand the inner workings of government a little better now than I did before. So thank you guys. With that, we'll open it up to public comment for folks. We're a little early, but if we've got some folks who came here to share some information that is not a member of the council or on the agenda otherwise, I'll open it up to you. Please raise your hand in your little cube square here, or drop a comment in the chat. We'll give a little bit of pause. This is my monthly time to give credit to Councilmember Jackie Serrano for her telling me that I need to be better at giving pause. So for those of you that don't know, Jackie and I have known each other for a long time. So like she's great, and appreciate her feedback to help me continue to grow. All right, well, that has been your moment of Zen. If anybody gets that reference, but not a couple of head nods. So I think we'll close public comment. Thanks, Jackie. That's the kind of cheerleaders that I need in my life. I appreciate you, my friend. I'll turn it over to Annette then.
All right, thank you, Adam. Looks like we are ready to adjourn our next meeting. If there are no other comments from the SOCAC, our next meeting is December 3rd, 12:30 to 4. Keep an eye on your emails for agenda updates that we'll be having. Any other questions? Any other comments, Anna? Before we dismiss for today?
I know a lot of people have been wondering about the youth behavioral health workforce task force that the SOCAC is tasked with convening from House Bill 4151. The first meeting will be taking place this week or next week. I can't open my calendar right now because I'm managing so many things for the Zoom. But that work is kicking off, and it will we'll have a report on where that is going, coming back to the council either in December or in our first meeting in 2025. So that's a big deal for folks, and it is in process. And I also see April's hand up.
You actually answered the question I was going to ask. Thank you. And also, hey, y'all, I know as the day gets darker on the West Coast, I know my anxiety is going through the roof right now. And I just really appreciate that, that we're all here and we're all continuing to have the right conversations for how to keep Oregon moving forward. It encourages me when I see folks with lived experience and partners across the system just staying dedicated to making things better in our state. I just wanted to acknowledge that it's not always easy, and today is certainly a distracting day. And I am absolutely convinced we are going to keep figuring it all out no matter what. So I just wanted to say that.
I keep showing up for these kids. I hear you.
I just want that to be the last word. Well, on April's mic drop, take care of yourselves and someone else if you can, and we'll see you back here soon.